Hi, I'm Danielle Cotton and I'm here to deliver you the Prime Times for August. A proposed merger between two top 5 US insurers, Anthem and Cigna, may lead to the creation of the country's largest insurance company, with a total membership of over 53 million people. The $48 billion deal, which is likely to take at least a year to close, may make good business sense for the parties involved, but it is not without its detractors.
In the wake of the Affordable Care Act in the US, large insurers have rushed to merge in order to have more bargaining power with regards to setting rates when negotiating with the government. This has brought such mergers under close scrutiny by regulators, who are incentivised to make sure that premiums are low and that competition in the health insurance sector is healthy.
This scrutiny has led to investors in Anthem and Cigna to worry, as perceived risks surrounding the merger's outcome has seen stock prices fall in both companies, adding up to over $1 billion in value in the few days following the merger announcement. Likewise, Aetna's stock has fallen by more than 10% since its announced plans by another large US-based insurer, Humana. Will any of these mergers succeed in the end? At this point, we just have to say, wait and see. A small study in the Journal of Adolescent Health has reported on attitudes regarding health insurance among so-called young people, which in this case is actually people aged 19 to 30 years old in the United States.
The reportedly highly educated group shared their thoughts after shopping for health insurance via healthcare.gov. Interesting results of the study include that many participants exhibited poor health insurance literacy, with 78% unable to define coinsurance correctly and 48% unable to define deductible. Other findings were that the biggest detractor from purchasing insurance was its cost, which, in their minds, far outweighed the biggest benefits, which were access to preventative or primary care and peace of mind.
The study shows that younger adults may take for granted their health and focus on short-term costs more than potential losses associated with medical care, and that their general health insurance knowledge leaves a lot to be desired. This also shows the benefit of utilising a third-party insurance agent to help young buyers understand the ins and outs of purchasing health insurance. Pacific Prime comes to mind. Our last story is one that should come as good news for everybody. The European Medicines Agency has given their final approval for a new malaria vaccine that could have a large impact on the global prevalence of the disease, which the World Health Organization estimates currently responsible for the death of 1 child every minute.
Over 584,000 people died of malaria in 2013 alone. This terrible disease, which is primarily spread through mosquito bites, is most common in areas such as Central Africa, India, Indonesia, and other southeastern Asian countries with wet climates where mosquito populations flourish and virtually everyone is at risk. Now, the GSK vaccine, Mosquirix, has the necessary approvals to account for its quality and safety, and is merely waiting for the WHO to offer a recommendation on how it is to be spread across the globe, if at all, to those that need it the most.
While the vaccine only promises partial protection against malaria, in trials it has been shown to reduce severe malaria by 36% and clinical malaria by 46%, and has been proved especially beneficial for children aged 5 to 17 months. The vaccine could definitely save a lot of lives. Here's hoping that it gets to be where it's needed most soon. That's it for this edition of Prime Times. We'll be back next month for another dose of health and insurance news. Until then, for all your international health insurance needs, please be sure to check out pacificprime.com.